Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. This week on the podcast, I'm joined by our deputy editor, Nick Bostock.
Hello.
And senior reporter, Kimberley Hackett.
Hi everyone.
To talk about some of the latest news affecting general practice. Coming up, we're talking about some of the challenges the NHS could face this winter and what all this means for general practice. We're also looking at how the GP jobs crisis is affecting locum GPs and discussing some worrying signs that the lack of detail on any support practices are likely to receive on employers' national insurance contributions is having a devastating impact on some practices. And we'll be talking about whether GPs in Wales and Scotland could be following their English counterparts and launching some form of industrial action in the push for a better GP contract. Our good news story this week is about an ICB area in England which is bucking the trend and seen a big fall in the number of patients per GP over the past 2 years. We're looking at what they've done to achieve that. That's all to come on this episode of Talking General Practice. First up, let's talk about what sort of winter the NHS could be facing as we head towards Christmas. Nick, there was quite widespread reporting last week of warnings from senior doctors and NHS figures that we could be in for a tough winter this year. Doctors and officials were warning of a quademic. Why are they concerned?
What's triggered these stories is that through winter, the NHS produces weekly data to try to demonstrate and raise awareness of pressure on healthcare services. And the first set of data for this winter came out last week. So the comments about the NHS facing a potential quademic are based on these figures showing that levels of 4 viral illnesses are on the rise: flu, norovirus, COVID, and respiratory syncytial virus, or RSV. The number of people in hospital with flu at the moment is about 4 times the level at this time last year. Norovirus cases are nearly double this time last year, and COVID and RSV are also increasing. I've also had a look at figures from surveillance in GP practices, and those show that cases of flu-like illnesses are increasing too. So there's evidence that these viruses are driving up workload across primary and secondary care. But the real reason why there's this sort of real urgency about these warnings of a potential quademic is that these rising levels of illness have come at a time when the health service is already under massive pressure. The weekly winter update shows that almost 97,000 hospital beds are currently occupied, and that's the highest figure ever recorded for this time of year. So numbers of patients arriving at hospital by ambulance are up compared with this time last year, calls to 111 are up, and so on. And so the fear is that against this backdrop of a health service under a lot of strain, rising levels of these 4 illnesses could be really difficult to cope with.
Part of the reason that the NHS are issuing these warnings is to encourage people to come forward for vaccinations, isn't it? What do we know about vaccination rates for this year? Obviously, we've got the standard annual flu campaign. There's COVID vaccines for high-risk people and NHS staff. And then there's the new RSV vaccination campaign this year for older adults and pregnant women. What are uptake levels like for all of those things? Do we know?
I've only got figures for parts of this, but for flu jabs, uptake is highest among over 65s. Just over 71% by the end of November, according to the UK Health Security Agency. But in all the other eligible groups, uptake is a lot lower, around 40% in children aged 2 or 3, 36% in people aged under 65 who are in an at-risk group, and just 32% in pregnant women. We also know that uptake of flu and COVID jabs among NHS workers was fairly low in figures for the end of October. So by that stage, only 1 in 4 NHS staff overall had received a flu jab, and about 14% had received a COVID jab. And those figures are actually higher among GPs, roughly double the overall NHS level for both flu and COVID jabs. So it's sort of getting on for half of GPs had been vaccinated against flu by the end of October. You mentioned RSV vaccination had been offered since September to pregnant women and over 75s. The latest figures I could find show there have been just over 1 million RSV jabs for older adults and about 90,000 for pregnant women. I don't have uptake percentages for those groups, but they don't look close to full coverage. So across the board with these vaccination campaigns, ultimately, there are some really big gaps in coverage, which has amplified these concerns about the potential for a quademic. And as you said, it's a big part of this message to try and get more people to come out and get vaccinated as soon as possible.
And what do we know about pressure in general practice at the minute? I mean, you wrote a story last week about the appointment data figures for England that showed in October this year, practices delivered the highest numbers of appointments on record. That suggests things are pretty busy, doesn't it?
Yeah, it does. General practice delivered more than 40 million appointments in October this year, which is the highest figure ever recorded for a single month. And in fact, I've just said something else about another statistic that was the highest ever in hospitals. So that gives you a sense that this is an NHS-wide sort of issue. So excluding COVID vaccination appointments, the total was still a record, 38.6 million, which is 13% higher than October last year and 25% higher than the total for October 2019. And if you include the COVID jabs, it's actually 30% higher than October 2019, so before the pandemic. And if you look at the figures for the first 10 months of the year as a whole, so the first 10 months of 2024, general practice has actually delivered nearly 310 million appointments. And not so long ago, that would have been a normal figure for a full year. But this is what GP practices have delivered in just January to October of 2024. And compared with the same period in 2019, general practice has delivered nearly 50 million extra appointments so far this year, so it's a fifth more. So the jump is really huge, and GP leaders are saying it's just not sustainable, particularly given that the GP workforce, despite some signs of recovery in recent months, is still way smaller than it was about a decade ago. It's worth noting that October is always a month with really high levels of patient contacts. It was the high point last year and in 2019, and that probably reflects in part some of what we've just been talking about, seasonal workload, delivering vaccinations, that kind of thing. But obviously this October has been far busier than even previous Octobers, and the concern is that the kind of pressure general practice is under means increased risk of burnout, GPs deciding they've had enough and want to leave the profession. And again, this is the pressure on general practice as we head into winter at a time when pressure across the board in the health service tends to ramp up.
Yeah, and I suppose obviously you've got the pressure of additional patients being poorly and everything, but also all these viruses running rampant around all over the place. Then obviously there's the real risk of staff getting ill, and that just adds more pressure to the system. I mean, are there systems locally to measure this kind of pressure on practices? A year or so ago, the RCGP was calling for an alert system like the Opal system that hospitals have, which would trigger extra support for practices in particular areas if they were at risk of being overwhelmed. Do we know if there's been any progress in getting those systems up and running in time for this winter?
We reported a while back, and we've talked about this a couple of times on the podcast before, I think, on a system that was set up in Devon, the GPAS, or General Practice Alert State System. And that asked practices to report two really simple measures. The idea was basically it's something so simple that practices, even if they're under a lot of pressure, should be able to report this data. They rate the level of pressure they're currently under on a green, amber, red, black scale, so a 4-point scale. And they're also asked to say how many contacts they had on the most recent Monday and what their list size is, so you get a sense of the proportion of their patients that they've seen that Monday. And those two quick bits of feedback compiled from practices across an area were turned into an area-wide pressure rating. And then that can be converted into something similar to the black alert system used in hospitals, the operational pressures escalation levels, or OPAL system. And LMCs across the UK actually adopted that system over the past couple of years. It hasn't been taken up uniformly, but quite a number of LMCs have used it, are using it. And Devon was until recently producing national reports showing pressure on general practice across the country based on that data that LMCs were collecting. Those national reports have now stopped, unfortunately, but LMCs are continuing to use the system, and they say that it's been really helpful in demonstrating pressure on general practice, and then as something they can use as leverage locally to push for additional support when they're talking to ICB managers and so on. The thing about the OPAL system that hospitals use is that when pressure reaches a certain level on the scale, automatic responses kick in to try and ease the pressure. So there's a whole framework set up to trigger those responses. So if they hit something like a black alert, routine appointments can stop while they focus on the most urgent cases to try and get themselves back on track. And we reported earlier over the summer that in Kent, GPs had agreed to trial an OPAL-like system for general practice. And some similar agreements have been set up in other parts of the country too. So those agreements do exist, but they're piecemeal. NHS England said over the summer that it's working on plans to bring primary care under the umbrella of the Opal framework over the coming year. And that has begun to happen in parts of the country. But at this stage, it's not uniform, so there's a long way to go until general practice has the same kind of level of support and protection from the Opal system that hospitals currently receive.
I'm sure over the coming months we'll be keeping an eye on what's going on in general practice and how practices are coping with these pressures as the winter continues. Moving on, we've talked on the podcast a lot over the past year or so about the impact the GP job shortage is having. One group of doctors that's been hard hit by the current situation is locum GPs. Kimberley, you wrote a story last week that looked at how the job shortage is affecting locum GPs. What did you find?
Yeah, so I was speaking with Dr. Richard Fieldhouse, who is chair of the National Association of Sessional GPs, and he told me that the 3,000 locum GPs who are members have reduced their fees on average by £2 per hour, which is roughly equivalent to a 2% drop. It means that this reduced rate will strip thousands of pounds a year from the average income for a full-time locum GP. And he knows this because his organisation has been tracking its members' booking data from June 2022, and he saw the fee reduction begin about 6 months ago. Now, he believes the drop in fees is because there is an oversupply, as he puts it, of locum GPs and not enough jobs for them. Now, it isn't necessarily that GP practices don't need the locum GPs, but it could be that practices are not able to afford to hire locums after years of core general practice underfunding.
Yeah, that seems likely to be the reason, doesn't it? Because we know that many GPs are already struggling to find salaried GP jobs, and quite likely cutting locum sessions is one of the things that practices will have done in light of falling income. Nick, the BMA warned recently that competition for jobs was leading to falling rates for locums as well, didn't it?
Yeah, so it's obviously all part of the problem we've been reporting on for some time with qualified GPs being unable to find work. Both the BMA and RCGP have said that thousands of GPs have been unable to find work or to find enough work. There was a BMA poll in the summer, for example, that found 56% of locum GPs wanted more sessions but couldn't find suitable jobs going, and 28% said they couldn't find any work at all. So obviously for these doctors, extra jobs created through the additional roles reimbursement scheme, which the government talked about as a potential solution to a shortage of jobs for qualified GPs, haven't necessarily changed the picture, because those jobs are only available to GPs who qualified within the past 2 years, so newly qualified GPs. And now this strange phenomenon of GPs struggling to find work at a time when general practice is incredibly busy has led to this situation where their rates of pay are actually being driven down. The BMA said at the end of October that unemployment among qualified GPs was pushing down the rates that locums could charge, as you said, because of increased competition. And this has meant that they're now facing a substantial loss of earnings, as Kimberley said, even if they can find work. So in a year when the DDRB recommended a 6% pay rise for doctors in general practice across the board, which was a lot less than the BMA wanted, locum GPs are having to accept an actual reduction in pay. And the knock-on effect of this, the BMA says, is that more and more of these doctors are considering following many others before them who've moved abroad to find work or moved into other careers. And I think that's something Kimberley's going to come on to a bit more.
GP Online and our sister site GP Business, we carry out an annual GP locum rate survey, and that enables us to track changes to the average levels of pay locum GPs receive from practices. We're due to run that survey again in January, so if you are a locum GP listening to this, please look out for that in the new year and take part if you can. Obviously, we'll be writing about the findings from that survey in the new year as well, and probably talking about them on this podcast. Kimberley, on the same sort of topic, you also wrote a story last week about GPs being added to the additional roles reimbursement scheme, as Nick mentioned there. We've talked about this on the podcast before, and as Nick mentioned, that was obviously the government's plan to deliver 1,000 extra GP jobs. But your story that you wrote last week suggested that the ARS plan isn't really helping, didn't it?
No, not really. So one GP trainer told me that despite the availability of the ARRS GP jobs, he knows of a GP who qualified last year but is still considering a move to Canada. And it seems that Canada is a popular destination, as the trainer knows of another GP who is also an international medical graduate who qualified in August and has just moved to Canada. Now, this GP is earning more money, seeing fewer patients, and overall has a better work-life balance. We know that more than half of doctors in GP training are international medical graduates, and when they qualify, they only have 4 months to find a practice that will sponsor them for a visa, and if they don't find this, then they have to leave the country. So moving abroad when you have already done so to study here is not as unrealistic as some may think. In fact, the GP trainer specifically told me that he hasn't heard anyone say they are planning on staying because of the ARRS GP jobs. But on the flip side, there are some positives to the scheme. Another GP trainer said that his PCN has hired a GP through the ARRS, which he described to me as refreshing because the GP was already training locally, so it meant there was continuity of care for patients. But while we know that funding for the ARRS GP jobs will continue beyond March 2025, the government has yet to put an exact figure on this, and according to the trainer, this uncertainty is a concern for some GP registrars. He also told me that ideally, GP registrars want salaried positions when they qualify so they can settle in one place, and they will only apply for an ARRS GP job as a last resort.
Yeah, it's not necessarily the silver bullet to solve the GP job shortage, is it? I think it's also worth mentioning one other really important story of yours, Kimberley, from this week that's on a slightly different subject but very much linked to all this. We've talked a lot on the podcast in recent weeks about the impact that the rise in employers' national insurance contributions is going to have on practices. It's linked to what we're talking about because obviously this is all about practice funding, and we know lack of core funding is the key reason behind the GP job shortage. And this rise in employers' national insurance contributions is going to have a disastrous impact on practices' finances potentially. GPs and others have been calling for some reassurance from the government since the budget was announced in October that practices would be protected in some way from these rising costs. But Kimberley, you wrote a story this week that shows just how devastating this uncertainty about funding is on the ground. This is about a practice in Yorkshire. What's going on there?
So a combination of years of underfunding to core general practice, an increase in minimum wages, and then the national insurance hike could be the final nail in the coffin for this practice in North Yorkshire. The GP Partners told its LMC that if a solution to the national insurance hike isn't found within the month, they will be forced to close and hand its contract back at the end of December. Dr. Brian McGregor, who is the medical secretary of YOR LMC, told me that this particular practice is already in a position where the GP partners earn less than the salaried GPs. And with the national insurance hike, the partners could lose an additional £15,000 to £20,000 of their own income.
Those are quite staggering figures, aren't they? I mean, the LMC you mentioned there is really worried that if this practice closes, it could then have a knock-on disastrous impact on neighbouring practices. What did they tell you about that?
So this particular practice has a list size of 10 to 15,000 patients. Now, the first point of call would be the hope that someone would take the practice over if it were to close. But if that doesn't happen, then these patients will be registered with other practices in the area. And Dr. McGregor said that if this does happen, then there is the very real possibility that the other practices could start to crumble too, because they will be unable to cope with the increased workload. In fact, Dr. McGregor said that of the 130 practices that are members of the LMC in North Yorkshire and Bradford, almost 1 in 10 are on the edge of being financially non-viable in the next 12 months. He said that without an uplift into core general practice, there will be practice closures next year.
Yeah, this is something that the BMA has been warning about since the budget was announced, isn't it?
Yeah, that practice, this idea of the partners already earning less than the salaried GPs, that's something we've talked about in the past. That's like the definition of a zombie practice. It's a really important example of how the uncertainty for practices that's been caused by the autumn budget is having a real world impact right now, even though the changes in the budget don't actually kick in until April 2025. So practices are really worried about the fact that increased employer national insurance contributions and the rise in the minimum wage, as you mentioned, from next year means £30,000 to £40,000 in extra cost for an average practice. We've talked about the fact that could strip away half the uplift they received from this year's contract. The government's made some comments suggesting it wants to help, but others suggesting practices will actually have to bear these extra costs. And statements from the primary care minister suggest that ultimately practices won't find out exactly where they stand until next year's contract is agreed. So that might not come until close to the start of the next financial year. And in the meantime, practices are having to make hard financial decisions like this practice that you've just been talking about, Kimberley. So GPs really need detailed assurances urgently from the government. And if those don't come, this may not be the last practice to consider handing its contract back, unfortunately.
We've talked a lot on the podcast over the past few months about collective action in England and what the BMA is hoping to achieve with this. But GPs in Scotland and Wales also look to be heading towards industrial action. Let's take a look at Scotland first. Nick, we know that practices in Scotland, Wales and Northern Ireland as well are also very unhappy with their contracts and with core funding in those countries. They're also facing workforce shortages, huge workload, practices closing. It was the Scottish Local Medical Committee's conference a week or so ago. What was discussed there and what's actually happening in Scotland?
On the 29th of November, Scottish LMCs met near Glasgow for their annual conference, and Dr Ian Morrison, who's the BMA Scotland GP Committee chair, revealed results of a poll. And that showed that 2/3 of Scottish GPs are ready to take industrial action. The contract uplift for Scotland this year was slightly less than the one for England. It was a 6.5% increase in global sum funding compared with 7.4% in England, although it's worth mentioning that the two aren't any longer directly comparable because in Scotland, for example, the Quality and Outcomes framework, the QOF, no longer exists. But Dr Morrison said BMA polling showed that the contract for this year in Scotland had made 2/3 of GPs more likely to leave the NHS, and it had reduced morale for around 9 in 10 GPs. And he said that coming from an altruistic profession like general practice, this result showing that 2/3 of people are prepared to consider industrial action now is all the more stark. He said industrial action is a last resort, but that unless there's a big change in direction from the government, ultimately practices could well be pushed in that direction. And after a vote for more significant action in England, something similar now could be on the cards for Scotland too. The Scottish Health Minister also spoke at the Scottish LMC's conference a few hours after Dr Morrison, and he said the government would invest an extra 13.6 million in general practice services in the current financial year. So that suggests they understand the strength of feeling that there is in Scotland in general practice. But it obviously remains to be seen how far that'll go to pull practices back from the brink of action. And interestingly, the government in Scotland is on side with GPs when it comes to the impact of national insurance. The Scottish Health Minister said it was completely unacceptable that GPs had been landed with these extra costs, and he's called on the UK government to cover the extra costs in full. And if he wins that argument, perhaps there could be a knock-on benefit for GPs in other parts of the UK when it comes to the impact of the autumn budget.
So let's have a look at what's going on in Wales. So in Wales, the BMA is in the midst of a referendum of GPs about the proposals for the 2024-25 GP contract. So just to be clear, this is the contract for this financial year, not the contract for next financial year. So we're almost heading into the last quarter of this year, and there's still no deal in place for this year. So the referendum launched in Wales, the referendum launched on the 25th of November and it closes next week on the 16th of December. It was launched after the BMA GP Committee in Wales voted unanimously to reject the final offer from the Welsh Government. The BMA called the deal insulting and said it failed to provide a credible and sustainable future for general practice. In communications to GPs, the BMA said the deal showed a disregard for the severity of the pressures faced faced by GPs across Wales. The main concern obviously relates to funding. The BMA says that the level of funding put forward by the government fails to provide the investment practices need. The Welsh Government, for its part, says this is its best and final offer. The BMA says it's extremely unlikely that under this deal, GP partners would receive any sort of reasonable increase to their pay, despite the government accepting this year's DDRB pay recommendations that all GPs and practice staff should get a 6% pay uplift. The BMA also says that the deal will inevitably lead to practices having to reduce or review their staffing levels because they won't have enough money. So the referendum is asking BMA GP members whether or not they accept the deal, and the BMA is encouraging GPs to vote no. Obviously, if the profession votes against the deal, which seems very likely, this could well be the first step on the road towards a ballot on industrial action. It's worth mentioning that back in the summer, the BMA in Wales published a report which had results of a survey that showed almost 3/4 of GPs in Wales said they were prepared to take industrial action unless the government boosted GP funding. The same poll also found that 9 in 10 doctors were currently unable to meet patient demand, and a similar amount felt that this was affecting patient safety. Obviously, we need to see what the results of the referendum will bring next week and what that might mean for action by GPs in Wales. As ever, there's been quite a lot of bad news to talk about on the podcast today, which is why we always try to round up with our regular good news slot. And this week, we have a really positive story about the GP workforce. So, Nick, this comes from our GP Insight project, doesn't it? As part of the work we do on GP Online, looking at data from around the NHS, we have our GP workforce tracker, which looks at a range of measures about the workforce at ICB, sub-ICB and PCN level. The key metric we look at is patients per GP, and we talked about the national picture and variation between areas on that patient per GP figure on the last news podcast. But we've been running the workforce tracker for a couple of years now, and that's enabled us to spot trends with what's going on. And you spotted a really positive trend in that data, Nick. What did you find?
Yeah, so on the last news podcast, we talked about the fact that across the board, there's a rising gap between areas with the most patients per GP and those with the fewest. And over the past 2 years, from September 2022 to September 2024, there's been a slight rise in numbers of patients per GP, basically because the population has grown slightly faster than the GP workforce over that period. But one area in particular, Sussex ICB, has really bucked the trend, which is an interesting story that shows it's possible to grow the GP workforce and to bring down the numbers of patients each GP is responsible for. And ultimately, that's something that should help to make general practice more manageable for GPs and safer for patients. In September 2022, Sussex ICB had 2,370 patients per fully qualified full-time equivalent GP. And at the time, that was the 12th highest number of patients per GP in any of England's 42 ICB areas. And these are, like you said, according to the figures from our GP Insight data project. And by the following March, patients per GP in Sussex had gone up even further and hit 2,421. So that was the 10th highest ICB in the country at the time. And at that point, it was 6% above the national average, 35% above the 1,800 patients per GP, which is often cited as a sort of safe limit by GP leaders. Fast forward 18 months, though, so to now, September 2024, well, it's not quite now, but a couple of months ago, and it's completely transformed. Sussex has gone from the top 10, as we mentioned, most underdoctored areas in the country to one of the least. So patients per GP now dropped 8% over the 2 years to September 2024 in Sussex, and are down more than 10% compared with that high in March 2023. And it's now just outside the bottom 10 ICBs in the country for patients per GP.
You've spoken to GPs and the ICB in Sussex. What did they do to achieve these results?
Yeah, so in Sussex, registered patients grew less quickly than in England as a whole over the past 2 years. So that helped. They rose by just 1.5% compared to 2.5% or so across England as a whole. But the fully qualified full-time equivalent GP workforce in the area rose by just under 11% over those 2 years. And that's more than 7 times the national increase. And that's the real key to the change here. So Sussex ICB said a drive to improve GP recruitment, retention and workforce development were the key to moving the dial. So part of it was to do with increasing GP training places, which is something that's happened nationally. But also the ICB has chosen to maintain a local version of the fellowship and mentoring schemes for general practice that was scrapped nationally earlier this year. ICBs across the country were allowed to keep the money for those schemes, and they were asked to continue them if they could. But at the end of the day, that funding was no longer ring-fenced. And some other ICB areas have decided to shift that funding into other priorities, or, they would probably argue that they've been forced to shift it to other priorities because they're short of money. So ultimately, this is a success story for recruitment of GPs, and according to the ICB, it's built on support for the general practice workforce for the kind of retention measures that the RCGP and the BMA are calling for as part of the kind of national plans they want to see rolled out as part of the 10-year plan for the NHS that the government's working on.
Well, that's it for this week. Thanks for listening, and thanks so much to Nick and Kimberley. I'll be back next week, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice on our website at GPonline.com.